Hello and welcome to the topic Carcinoid Tumours in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define carcinoid tumours, discuss the pathophysiology of carcinoid tumours, describe the clinical presentation of carcinoid tumours, outline the investigations in the diagnosis of carcinoid tumours, and finally discuss the principles of management of carcinoid tumours. Let's get started. So, what is a carcinoid tumour? Carcinoid tumours are a type of neuroendocrine tumours that grow from neuroendocrine cells. Neuroendocrine cells receive and send messages through hormones to help the body function. These cells are found in organs throughout the body. Carcinoid tumours often grow very slowly, so it is a slow-growing type of neuroendocrine tumour originating in the cells of neuroendocrine system. In some cases, metastasis may occur. Carcinoid tumours of the midgut, which is the jejunum, ileum, appendix, and the cecum, are associated with carcinoid syndrome. Carcinoid syndrome is caused by a carcinoid tumour that secretes serotonin or other chemicals into the bloodstream. It occurs most often in the gastrointestinal tract as mentioned earlier. So they are generally classified based on the location in the primitive gut that gives rise to the tumour, which is the foregut carcinoid tumours divided into sporadic primary tumours, which could happen in the lungs, bronchus, stomach, proximal duodenum, pancreas, and tumours secondary to achlorhydria. Midgut carcinoid tumours are derived from the second portion of the duodenum, jejunum, the ileum, and the right bowel. Hindgut carcinoid tumours include the transverse colon, descending colon, and the rectum. As for the symptoms, one would experience cutaneous flushing, and this typically affects the head and neck, often associated with an unpleasant warm feeling. Apart from that, other symptoms include itching, rash, sweating, palpitations, upper body erythema and edema, salivation, diaphoresis, lacrimation, and diarrhea. The signs that are seen in large tumours may include diarrhea and malabsorption, which makes about 84% of the entire clinical manifestation. One would expect to have watery, frothy, or bulky stools, sometimes also steatorrhea or gastrointestinal bleeding. However, these signs may or may not be associated with abdominal pain, flushing, and cramps. Apart from that, 60% of them actually do manifest cardiac complaints, such as having valvular heart lesions, fibrosis of the endocardium, which may lead to heart failure with tachycardia and hypertension. 25% of them might have wheezing or asthma-like syndrome, and this happens due to bronchial constriction with some tremors that are relatively indolent and result in chronic symptoms such as cough and dyspnea. Other than that, you may also want to look out for signs of pellagra, which are scale-like lesions, diarrhea, and also mental disturbances. A carcinoid crisis can be the most serious presentation of carcinoid tumours and can be life-threatening. It can occur suddenly after a stressful event or following chemotherapy and anesthesia. Laboratory diagnosis of carcinoid tumours depend on the identification of the characteristic biomarkers of the disease. Hence, we have a few modalities which help us diagnose the condition. A urine test specifically looking for 5-hydroxyindoleacetic acid, or also known as urinary 5-HIAA levels, are usually increased, and this aid in the assessment of carcinoid tumours. As for blood plasma levels of 5-HIAA assay is more stable than whole blood serotonin assay, and it's more convenient than a 24-hour urine collection. Upon histological examination, carcinoid tumours have 5 distinct patterns, which include solid, nodular, and insular cords. Secondly, trabecular or ribbons of anastomosing features. Thirdly, tubules and glands like rosette-like patterns. Fourth, poorly differentiated or atypical patterns, and 5 mixed patterns. A combination of these patterns is also often observed. As for imaging studies, one could do a chest X-ray, a computed tomography or CT scan of the relevant areas, an MRI scan, which are all quite useful in the diagnosis as we are looking out for a particular tumor. An octreoscan is a special type of scan that is most often used to find carcinoid tumors. This scan is taken after injection of a radioactive substance that is picked up by the carcinoid tumor cells. Apart from this scan, one could also do an ultrasound, including an endoscopic ultrasound if there is suspicion of an endoscopy or a gastrointestinal tract tumor. Apart from that, positron emission tomography scan or PET scanning or radionuclide imaging with somatostatin analogues attached to the radioactive tracer can also be done. As for management, medications are provided to block cancer cells from secreting chemicals. Injections of the medication octreotide and lenriotide may reduce the signs and symptoms of carcinoid syndrome, including skin flushing and diarrhea. A drug called telotristat can be combined with these drugs to control diarrhea caused by carcinoid syndrome. Apart from that, one could also use drugs that deliver radiation directly to the cancer cells. Peptide receptor radionuclide therapy or PRRT combines a drug that seeks out cancer cells with a radioactive substance that kills them. Next would be stopping the blood supply to certain tumors, and here particularly liver tumors. In a procedure called hepatic artery embolization, the doctor inserts a catheter through a needle near the groin and threads it up to the main artery that carries blood to the liver, which is the hepatic artery. Then the doctor injects particles designed to clog the hepatic artery, cutting off the blood supply to cancer cells that have spread to particular areas of the liver. Another modality would be killing cancer cells in the liver with heat or cold, and this is done by radiofrequency ablation, which is delivered through high heat via a needle to the cancer cells in the liver, causing the cells to die. Cryotherapy is similar, but it works by freezing the tumor instead. Last but not least, chemotherapy, which uses strong drugs to kill the cancer cells. Chemotherapy drugs can be given through a vein or intravenously or in oral form, or both methods can be used. As for surgery or resection in particular, surgeons often try to cure the localized carcinoid tumors by removing them completely, which is usually successful. The options for GI carcinoid tumors that have spread to nearby tissue or to distant parts of the body are a little bit more complex. Other endoscopic procedures can also be carried out, which may be used for biopsy and diagnosis, and this includes bronchoscopy, esophagogastroscopy, gastroscopy, as well as colonoscopy. Most patients with resectable lung carcinoid tumors are cured with surgery alone and don't need other treatments. But some experts recommend further treatment for people with atypical carcinoid that has spread to lymph nodes, and this can be chemotherapy, radiation therapy, or even both. To summarize, we have understood that carcinoid tumors are tumor of the cells from the neuroendocrine system. So they are very specialized neuroendocrine cells that are also involved in the release of certain hormones. We have looked at the pathophysiology and certain causes of the tumor. How do they present clinically? The important investigations that help us diagnose as well as locate the location of the tumor. And finally, management approach, which includes both medical and surgical approach to carcinoid tumors, medical approach where it involves delivering medications to either kill the cancer cells or to reduce the growth of the cancer cell via radiotherapy, and surgical approach which completely resects the tumor away. And these are the key points to be remembered in carcinoid tumors. We have come to the end of this topic. Thank you for your time.